welcome to Med Medicine with Miss P. Same as always, I'm in a hurry. I gotta go. I'm so running late. I got 100 things to do, as always. Oh my gosh, what I would give to be bored. And I got a whole bunch of fun stuff yesterday I have written down at work, so I'll bring it and we'll talk about it. It's fabulous stuff. Like, like when a patient tells you, what kind of surgery are you having? There's a little box. You can fill out your surgery, and the surgery he's having is his right knee down. He's having the right knee down, D-O-W-N. Now, even if he meant done, he's having the right knee done, that's not a surgery. But it's all right, at least he said right. Usually they just say, the doctor so-and-so is working on my knee. Okay, which knee? Because when you get here, you're going to be all spastic that we're going to do the wrong knee, yet you won't even tell me which knee over the phone we're doing. All the time. This other guy's having hernia surgery. Okay, I said, where on your body? And he typed in belly button. He didn't say it, because I could have just misunderstood that. No, he typed it in. He typed in under surgery his belly button. Over at the belly button is where his hernia is. Sure, it's just a little typo, but he did capitalize B in Billy, so there's that. Maybe it's his son. Also, patient, after you asking them repeatedly, he says, well, the only doctor medication I take is a statin. A doctor medication. The only doctor medication he takes is statin. Guess what it's called? Valsartan. That's not a statin. It's not a statin drug at all, like not even a little bit, but all right. And the reason the patient was having her surgery, because you can write in, you have to type in what your surgery is and then the reason. And her reason was she has an angry bladder. You know what? That's not untrue. Her bladder may be very angry. Those little bastards leak and they drip and they cause problems and they hurt and they won't work and they won't release, and it's bad. Her bladder is pissed off, and I totally understand. Oh yes, and another one, again, you can write in that box what surgery you're having done. Like, you need to tell us what you're having done so we know you're having the right thing done. And listen, patients out there are forever saying, like, no, it's my right eye. Like, oh, all this paperwork here says left. And she's like, well, I'm looking right now and I can't see out of my right eye. It's my right eye. And I'm like, I totally understand. You're correct. That's why we go through this. Thank you. I'll talk to the doctor's office. We'll get new orders. We'll, fix the mix up, whatever it is. Unlikely that happens. It's rare. But when it does, we have to get the information from the patient. They know what they're having done. Like this one guy a while back, I said, the paperwork said left Achilles. He goes, well, I'm looking at it and it's my right, and it's in a boot and it hurts. It's my right. Okay, it's his right. So, humans make mistakes somewhere along the line, somewhere in the paperwork. It was just, incorrect, and we fixed it, and then everything's fine. So in this box where we said, what procedure are you having done, she wrote in surgery, or typed in surgery. That's what she's having done. She's having surgery. Oh, that's good, because she's at a surgery center, so that's going to be helpful. Oh, also, in his surgery box, he wrote in that he's having an eyelid toss. They're tossing the eyelids. It's eyelid toss, T-O-S-S, not tighten, anything, straight up T-O-S-S. It doesn't need, I don't even know where he was going with that. One lady typed in, she either told me or she typed in, I can't remember, I talked to her about it, that her thumb jumps out of joint. My thumb jumps out of joint. It jumps right out of joint. Like, it's sitting there and all of a sudden it jumps out of joint. All right. Also in the box, the patient wrote in, the box I hate so much. What can we do to make your stay here better? They typed in just sterile facility. I don't know what that means. There's no such thing as a sterile facility in the world. I mean, our ORs are as clean as you can get an OR, but it's not sterile. Sterile means no living organisms at all. Like, we can't sterilize your skin. I know doctors say it. I know doctors tell patients, well, we're going to sterilize your skin before the procedure. No, you're not. Skin's alive. Sterile means no life, but that's okay. We know what you're getting at. Oh, also, someone else wrote in that they wanted a competent staff. Well, we're going to have to change some things that day then to get a competent staff. If you don't feel like where you're going, they're going to take good care of you, you may want to choose someplace else. But we have a very competent staff. Oh, and then this other lady, and I don't know if this is a funny thing or not, but it was so cute, and I think it was a coworker told me that this patient wrote in here like she had some confusion or she wasn't sure what she was having done, whatever. And I'm pretty sure she typed in "my brain is stupid," which I don't know if that was making fun of herself funny or if there's something deeper in there. But I thought that was. I have felt that way. I totally get it. My brain is stupid. I'm okay. It's just my brain that's stupid. Again, in that surgery box, what kind of surgery are you having? Unknown. The patient wrote in that the surgery is unknown to them. Under their understanding, they don't know what they're having done at all. It's completely unknown. I have a problem with that. Oh, procedure to be performed, and the patient wrote in location. It wasn't a question. They wrote in the word location. Again, I'm not sure how they're misunderstanding these questions, but it happens a lot. Especially that question, I know I've talked about this before, is when is the last time you had any aspirin, ibuprofen, Motrin, Advil, Aleve, or BC powders? And I think it says I have to physically ask that because they don't understand the question that's written, and it says, when is the last time you had aspirin or blood thinning medication? If so, what was it? And they'll write no, and then they'll type in their previous, if you say no, it'll give you a box. If it says yes, it'll give you a spot to put a date. Like when was the last time you had it, and you put the date in. They'll write no, and then they'll write in the last medications that they took. So it's like gabapentin, metformin, and lisinopril. Like that has nothing to do with the question. It literally just asked you about aspirin. Did your doctor tell you to stop your aspirin? I don't understand. It must be how it's worded because more people do that than they should. I think one person asked if they could have a full meal the date of service. That's a no. I don't even understand what that would mean. A cervical neck fusion. Another patient typed in their previous surgeries. They previously had a cervical neck fusion, which is good because your neck is where your cervical spine is. So that's helpful to really, DVT blood clot it because, in case you're not sure where that is. In that box I love so much, they wrote in "be successful." All right, maybe they're just pumping us up. Go out there and seize the day. Do you wear glasses or contacts? And they wrote in that they've had cataract surgery. That's not the answer to that question. It really is like a yes or no, and then if so, which one? If it's a no, it's a no. And if you're going to say yes to, you need to tell us if you have glasses or contacts. If you think that you have contact lenses in because you had cataract surgery, why don't you try to take them out? Take those contact lenses out. I'm going to wait right here. I'd like to see that, please. Oh yes, my blood pressure goes up before surgery. Now, of course, I took that out of the box. I just deleted it because it's too painful to see something so stupid written in there. But we all know that that's not how blood pressure works. And it can go up, but how high is it going? Is it worth talking about? We'll see. Occasional bouts of chronic bronchitis. Yes, this patient wrote in there under their pulmonary, there's a little box in there that says, like, you have any other issues or something like that. And they wrote occasional bouts of chronic bronchitis. All right, well, if it's chronic, we know that it's going to stay there, and it's not an occasional bout. It's chronic bronchitis, which means you are going to have flare-ups because that's what having chronic bronchitis means. But okay. Oh yes. What kind of surgery are you having? Meniscus cleaning. Meniscus cleaning. MENISUS cleaning. I don't know where that part of your body is, but I'm pretty sure that was just a knee scope. 22-year-old told me that he got morning sickness. I wish I was kidding. This is a 22-year-old male, and he wrote in there that he gets mornings. No, he told me this was on the phone. Yes, there was something chemically wrong with this guy. He rattled on and on and on and called back a couple more times. There was definitely something upstairs that, that elevator may not have gone all the way to the top or went to the top and circled repeatedly before coming back down. But he literally told me he gets morning sickness. Vertigo? I I think I asked him why he had Phenergan on hand, and I think that's what it was. Your last dose of aspirin, I can't take any. Right, so when was the last time you took it to find out that you couldn't take any? It's very simple. Just give me a date. I don't need your life story. But that same person was on 81 milligrams a day. I'm not kidding. Just like all the people that think they're allergic to penicillin but are on amoxil. It happens. I can't take any. And then in the med list, 81 milligrams of aspirin daily. Bacitracin topically gives a rash and erythema. You mean when it destroys the natural flora of your skin starts to become irritated and trying to build it back up with the current lack of microbials that you need to survive? Yeah, that's not an allergy. That's called contact dermatitis and that or maceration, and that's what happens when you put an antibiotic on your skin where you don't have an infection. A cut is not an infection. A cut's a cut. When it gets infected, then it's infected. Then you might need some sort of antimicrobial or an antibiotic. Oh, laparoscopic knee surgery. I get this every day. Every day. Patient told me yesterday, or no, she typed in that she had an endoscopic knee surgery. She had an endoscopic pelvic surgery. Everything was She thinks everything that goes inside makes it endoscopic. Endoscopic's down your throat. That's it. Nothing else. Everything else is directly related to the portion of your body we're working on. A laparoscopic knee surgery. That's fabulous. Penicillin with a Y. That was fun. Patient has an irregular EKG. Can you be more vague? No? All right, just checking. If I sell this once, I saw it 100 times, colonoscopy under local. I'm not saying it's not possible. I'm just saying I don't think I could ever do that. And I'm not sure how much local that would require, but it's not happening. My coworker told me that her grandmother said she's going to do her colonoscopy under local. Where would you even put a local? Along the lining? That's not a thing. But she didn't like the way she felt under anesthesia, so she was just going to do it without. If you come near my butthole without giving me anesthesia, we're both going to be bleeding. I'm just going to tell you that right now. A keratite surgery. He had an eye keratite surgery. Caradite. Keratite surgery in the eye. I'm assuming it's a cataract. Oh, and in that stupid little box, I am allergic to penicillin. Now that box has nothing to do with your allergies. There's a completely different spot for that. Oh yeah, I can't even, I'm gonna have to write this down. We got another gallbladder, GAOL, Goal bladder. And then this patient was on this medication. Again, if you write this, and as soon as you get to hydro, 50 different medications will pop up. I'm assuming you really want that to be hydrochlorothiazide. It is not. But I'm assuming that's where you're going with that. Oh yes, we have a coal bladder, and we had a goal bladder. Yep, both of those. Both surgeries, yeah. One of these patients had both of those. That's fabulous. And a 20-year-old female told me that she wrote in there that she had white coat syndrome. Yep, I deleted that faster than you can ask, why do you have white coat syndrome at 20, even though there's no such thing as white coat syndrome. I can't even with that. You know how I feel. And then this is what the box is for. If you're not going to be specific about something that you're having issues with to where we can make sure we take better care of you, this is what the box is for. This patient wrote in, I know I will receive excellent care. You know how she knows that? She's been here before, and that's how we do it. All right, face your fears, forget your failures, follow your faith. Love y'all.